Hello, welcome to my channel Aim to Alter, which will transform your life positively. My last video was about the breakthrough infection where you get COVID even after being fully vaccinated. So listen, vaccination does help in controlling the COVID spread, but that does not mean that we stop taking precautions of wearing a mask, using sanitizer, and social distancing. We need to act like responsible citizens and minimize the COVID spread by taking all measures we know well. However, living with this constant stress and fear caused by COVID, the mental health issues are rising. In today's video, I'm going to be telling how COVID has affected mental health and what we can do to understand the rising issues in trying to stop them. So, here we go. This coronavirus is taking a heavy toll on mental health of people across the globe. A major review of 36 studies across the world has found that around 1 in 3 people are suffering from stress, anxiety, or depression during this pandemic. A recent study suggests that unemployment caused by COVID-19 may have led to almost 10,000 additional suicides a year. COVID-19 is causing enormous stress for people who were already worried about how they will support their families. Loss of jobs or decrease in salary has made this problem worse. Moreover, amid this global pandemic, it is understandable that people are worried about their health, their loved ones, and how they will cope if they will get sick. Ongoing restrictions are limiting social interaction, leading to increased loneliness and isolation. We know how important it is to socialize. It is one of the first things we learn at school. However, this COVID has stopped us from socializing physically. Well, some people have made it a solution to socialize virtually, but I don't know if it can give the same effect. Hugging your friend or giving someone a satisfying pat on the back is not the way we should associate now. COVID has changed our socializing skills. This deprivation has given rise to mental health issues. What is more alarming that the latest World Health Organization figures reveal the pandemic has interrupted or suspended mental health support services in 93% of the countries. I wonder why the focus is only on COVID and not the other problems that are coming along with it. The mental health issue is a grave concern. It can destroy your life if you don't seek medical attention. However, people already living with mental health challenges are experiencing the loss of critical support networks and clinical management. COVID is potentially building a lot of stress. The stresses we are experiencing affect us physically, psychologically, and emotionally. It also changes our behavior. The stress undermines our ability to stay healthy, look after our families, and process new information. It can endanger nurses, doctors, police, leaders, and disaster responders, risking life-saving decisions to contain the virus and reduce longer-term impact. These people need this care more than ever. The coronavirus disease 2019 crisis places additional pressure on doctors and the healthcare systems in general, and the research shows that such pressure brings a greater risk of psychological distress for doctors. We simply cannot afford to wait until this epidemic is under control before dealing with the massive and increasing psychological toll. To have any hope of stopping and recovering from this pandemic in a way that leaves no one behind, we need to treat the psychological and physical distress at the same time. So how can we do it? Early intervention prevents distress from developing into more severe mental health conditions. We need to bridge the gap between those who need psychological and emotional support and those who seek it. Preventing psychological issues and mental health support need to be integrated at all levels in local communities, workplaces, schools, hospitals, and health systems. The trauma is real. People have lost loved ones, jobs, or livelihoods. They have been separated by borders or quarantined, stranded and jobless in other countries, or living in crowded camps. All too many are overcome by anxiety, depression, and distress, We all must support each other at this time. Get in touch, be kind to friends, family, neighbors, and colleagues, as well as ourselves. Taking good care of ourselves enables us to take care of others. To reduce the number of people infected with COVID-19, more and more of us are making huge changes to our daily routines. The new realities of working from home, temporary unemployment, homeschooling of children, and lack of physical contact with other family members, friends, and colleagues take time to get used to. Adapting to lifestyle changes such as these, managing the fear of contracting the virus, and worrying about the people close to us who are particularly vulnerable are challenging for all of us. Such adaptations can be particularly difficult for people with mental health conditions. So what we can do is to maintain a stable routine where we are doing more or less the same things each day. We need to minimize newsfeed about COVID because all they are doing is creating anxiety and panic in us. We can seek weekly information instead of going for daily updates. Social contact is important, but we can choose to call our friends if we can't meet them. Online channels are open to us for socialization. Don't rely on social media too much, as every piece of information is not true. Fear is a normal reaction in situations of uncertainty, but this fear should not go to the extent of causing mental health problems. Be careful and take good care of yourself. I hope you like this video. Please don't forget to like and subscribe to it. If you have any comments, leave them in the comment section below and I will surely get back to you. Keep watching my upcoming videos. In my next video, I'm going to be telling you more about how we can cope with COVID stress. Thank you for watching and I'll talk to you again with my next video.